Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. May is Stroke Awareness Month. Stroke is the second leading cause of death worldwide and the leading cause of disability. Have you ever heard the saying, when you're having a stroke, time is brain? What exactly does that mean? And how can you tell if someone is having a stroke? What can you do to prevent a stroke? We'll talk about all that and more today with Dr. Muhammad Alvi, Medical Director of Stroke at the WVU Rockefeller Neuroscience Institute. Welcome, Dr. Alvi, to Tuesday Talks.
Thank you very much, Mary. Thank you for having me.
It's great to have you here. Now, if you have any stroke-related questions, just submit them in the comments section below, and we'll try to answer them live. Okay, Dr. Alvi, let's first start with the basics. What exactly is a stroke?
So stroke, generally speaking, broadly divided into two different types of strokes. We have the blockage kind of stroke, called the ischemic strokes, and the bleeding kind of strokes, called the hemorrhagic strokes.
Okay.
The ischemic strokes, the blockage ones, they make the vast majority of strokes. So about 85 to 90% of the strokes are the blockage kind of strokes. In those strokes, there is a blockage in one of the blood vessels feeding the brain. And as a result of that, the part of brain that's not getting the blood flow is getting damaged. When it doesn't get its oxygen and energy, brain tissue is getting damaged. So that's and as a result of that, you get symptoms. So, for example, if it's the left hemisphere or left side of the brain, which is being deprived of the oxygen and blood flow, you end up with the right-sided weakness, and you end up with speech difficulties. So it's basically blockage of the blood vessel, and depending on what part of the brain is being affected, you get those some specific kind of symptoms.
Okay. So we were talking about, earlier that time is brain. We've heard that saying before. What exactly do we mean by time is brain when it comes to having a stroke?
Right. So for example, in the blockage kind of stroke, when we have blockage in one of the bigger blood vessels of the brain, lots of brain cells, about 1.8 billion brain cells are dying every minute. So it's very, very time sensitive.
That sounds like all of them.
So
1.8 billion.
And lots of connections between the brain cells are being disrupted, right? So everything is time sensitive there. So the eventual goal is open up that blockage, open up that blood vessel as fast as you can, and prevent the long-term damage to the brain. So that's where the saying comes from, time is brain. So if you're suspecting a stroke, you gotta get to the hospital as fast as possible so you can be evaluated and get some sort of intervention.
So the longer you wait to get treatment, the more damage you could be causing.
Correct. So the longer you wait, the damage may be irreversible, right?
Yeah.
So it's not one of those things you want to sleep off. So.
Yeah. Now, is there a window? Isn't there a window of, when you think a stroke has occurred, what's the window to get to the hospital for treatment to be effective?
So you got to get to the hospital as fast and as soon as possible. You don't wait. If you're suspecting stroke symptoms, and we can talk about stroke symptoms also, right? For recognition-wise. So generally speaking, we talk about the face, arm, and speech, right? So they're part of the FAST acronym. So any kind of facial droop, facial asymmetry. A is for arm, so any arm weakness, arm drift.
You can't raise your arm, right?
Correct.
Okay.
And S is for speech, so any kind of speech difficulties like slurred speech or inability to speak. Those can be the common stroke signs and symptoms. And if we add just a couple of additional symptoms like balance or eye symptoms like loss of vision or double vision, then the acronym a little bit longer, but it becomes more inclusive, which is B FAST, BE FAST.
Okay.
And it covers most of the stroke signs and symptoms. So if anyone is having those symptoms, constellation of those symptoms, or in isolation, just weakness on one side of the body, that's a 911 call. For most people, that's the fastest way to get to the hospital, right?
Yeah.
So that's a 911 call, get to the closest hospital or stroke center. And most hospitals have a stroke team and stroke activation process where if they suspect a stroke patient, a sequence of events happen which leads to early identification and treatment for those patients.
Yeah, because you're usually waiting at the door for them.
Correct. So for us here in Morgantown at Ruby, the EMS folks, once they pick up a stroke patient or patient suspected of having a stroke, they send us a pre-hospital alert. So the stroke team gets notified that the patient is 5 minutes away. We are in the emergency room waiting for that patient. We get the CT scanner open and available and ready for that patient. The lab is ready and waiting for those patients' initial blood tests. So everything is lined up in a very fast and efficient manner.
Because time is brain.
Correct.
And it's better to, even if you suspect a stroke and you're not sure, it's better to go to the hospital and be sent home than
Correct.
try to make up for lost time.
That is correct. So for stroke, it's such an emergency and a time-sensitive thing. It's better to go to the hospital. It's not one of those things that you would want to call your primary care and wait for a phone call back. It's truly an emergency.
Okay. So now we were talking about how, well, here at Ruby, the stroke team is activated and they're here waiting. But recently, well, within the last few years, we're taking advantage more in the outlying areas with telestroke. So let's first tell me what exactly telestroke is, and then we'll talk about like the huge impact telestroke is having on stroke treatment.
So telestroke is basically a video audio evaluation of a stroke patient in outside emergency rooms to help facilitate early treatment and recognition of stroke patients. So for example, most of our hospitals in the state would not have a neurologist and a stroke team there 24/7, right? So if a patient suspected of having a stroke shows up in those emergency rooms, they can call us. They have one phone number that directly connects to the doc on call for strokes that day. It comes straight to my cell phone. Get a story, evaluate their imaging, and then connect via video to see that patient. This way we can help the local emergency room with quick decision-making, treatment decisions like the thrombolytics, the clotbuster medicines, and if we need to transfer those patients, we can help with that transfer process also.
And you do telestroke with 31 hospitals in the state, right?
Correct. So 31 hospitals in total, and that involves West Virginia and the 3 adjoining states, Maryland, Pennsylvania, and Ohio.
Okay.
Yeah.
And I mean, it sounds like such a simple solution, but how has telestroke really saved lives and impacted a change in survival even?
So previously, a lot of these hospitals, if they had patients suspected of having strokes, they were either limited to a phone call conversation or they would put the patient in an ambulance and send them to us, which would eventually delay care, right? So
yeah, because it could take hours
Correct.
from some parts of the state.
Correct. So, and by the time the patient gets here, they may be outside of their treatment window. So over the years, as our telestroke programs has ramped up and increased the number of sites and the hospitals we cover, we are treating more and more patients with the clotbusters. We're evaluating more patients via telemedicine. And in the recent past, we treat more patients with clotbusters via telemedicine, via telestroke, than we treat in our local emergency room here at Ruby. So that's the impact of telestroke program.
Wow. And that's everywhere, and it's where it's needed.
Correct, correct.
Wow. We were talking earlier. It's really, telestroke has been revolutionizing, hasn't it, for stroke?
Absolutely. So for acute stroke care, telestroke has been a big revolution.
Wow, that's great. Now, there have been some other changes and improvements in stroke treatment, and you were talking earlier about clotbuster medication. And I know for years we were talking about, you got to get to the emergency department so you can get TPA or clotbuster medication. Now, there's been some big advancements in that kind of treatment.
Yeah. So just a little while ago, we were talking about the treatment windows. So within the first 4.5 hours of symptom onset, we can use the clotbuster medicines. Historically, we have had TPA, also called alteplase, and that has been around since the mid-90s.
Okay.
For basically a medicine given through the IV. And the goal of the medicine is to get into the system and try to open up the blockage, right? In that way, we can resume the blood flow and prevent the further damage of the brain tissue. In the last few years, a newer medicine called tenecteplase, or TNK, has come out, which has shown better chances of recanalization, meaning better chances of dissolving the clot and opening up the blood vessel. So in the last year or so, we as W Medicine have transitioned towards tenecteplase as compared to alteplase, and we have seen really good results with this medicine.
So you don't use the TPA anymore, you use the TNK, and it's faster and has a higher success rate.
Correct. And we still have the TPA available, but we've transitioned towards tenecteplase, and we're using, for the most part, all tenecteplase now.
Just a better treatment, huh?
Correct. Without any increased risk of bleeding, so it's a win-win.
Okay. Yeah. Well, that's great. That's big news, too. All right. Now, there have also been changes in, because with some strokes, you can't use the medications. You've got to go in and physically try to retrieve the clot.
Correct.
Let's talk about those changes.
Yeah. So that procedure is called thrombectomy or thrombus removal, right? So that procedure has been around for a long time. 2015 onwards, that became standard of care for large blockages. So blockages in certain blood vessels of the brain, that is a standard of care. And for some patients, even beyond that 4.5-hour window for the clotbusters, we can use these procedures. So based on the newer trials and the newer devices, we can potentially use these treatment procedures, the thrombectomy procedure, up to 24 hours from last known well.
Wow.
If there is some salvageable brain tissue in patients.
Now, what was the minimum before this change?
So initially it was 6 hours, and
oh, wow.
Yeah, so 6 hours from last known well was the initial treatment timeline for the clot retrieval. But over the years, based on advanced imaging analysis, we have expanded the treatment window to up to 24 hours.
That's a big change, too. Yeah. All right. Now, speaking of advanced imaging changes, artificial intelligence is being used now in stroke treatment. Talk about how we're using AI.
For the last year or so, we have implemented a new AI software which helps us with stroke image analysis. So anytime a patient at Ruby gets a stroke scan, which is basically a CT stroke with contrast, that software analyzes the image, the CT scan, and it looks for bleeding in the brain. It looks for any blockage in the brain and analyzes that automatically within seconds of the image being
Oh
acquired
my gosh.
and sends an alert to the on-call physician that I have detected a clot in this blood vessel, and we have this software implemented at Ruby and 4 other hospitals within the WV medicine system. So when we are on call, we get alerts from all these different hospitals. Uh, and it helps the radiologists in analyzing the images. It makes the whole process faster. It makes the likelihood of missing things even less likely. So it's very very fast and efficient. So so the application of AI in medicine, it's huge. This is just a very small snapshot of that.
Tip of the iceberg, huh?
Yep, absolutely.
Wow. So I imagine you're saving more lives and, limiting damage.
Correct. Moving things faster, and that's the goal. Once you're in the hospital, that's what we can control to significant extent. Once you're before the pre-hospital part, we have less of a control, right? So that's
Right.
the education part for patients. You suspect stroke symptoms, you got to get to the hospital. Once you're in the hospital, that's where a lot of our resources go in to have a very fast, efficient, and safe system in place to take care of
Okay.
those patients.
All right. Well, then let's talk a little bit about what we can control. I mean, is there anything we can do to prevent having a stroke?
Correct. So vast majority of strokes, they are preventable. So when we talk about the big risk factors for stroke, we talk about high blood pressure, hypertension. That's probably the number one and the
High blood
most high
pressure.
risk
Okay.
situation. Then we have diabetes or poorly controlled blood sugar. We have hyperlipidemia or high cholesterol, smoking. Those 4 are the big modifiable risk factors, with
Yeah.
high blood pressure being the number one. We take care of these things, we reduce our chances of stroke significantly. Beyond these 4, certain conditions like atrial fibrillation, the irregular heart
Oh,
rhythm,
yeah.
that's a big risk factor
Oh,
for
yeah.
stroke. And in that scenario, certain blood thinners significantly reduce the risk of stroke. Treating sleep apnea helps reduce the risk of stroke. So healthy diet and moderate exercise helps reduce the risk of stroke. Then there are risk factors which are there but somewhat beyond our control, like our age and genetics and family history and things like
Sure.
that. But the other stuff we talked about, that's significantly modifiable, manageable, and can be a game changer and potentially prevent bad stuff.
So stop smoking, control your diabetes, lower your blood pressure, control your blood pressure, right?
Correct?
High cholesterol.
Take care of cholesterol.
Take care of cholesterol. All within reach, right?
Yeah.
So, if you do have a stroke, what usually is the prognosis? What are the chances that you'll be okay? You'll come back from a stroke.
Yeah, so the recovery and prognosis part from stroke, very, very variable, right?
Yeah.
So if we start with a very severe stroke and we could not get any of the early treatments that we talked about, and we have already, and we end up with a large damage to the brain, it's going to take longer and more effort, more time to recover from that kind of stroke. You may need more help. Most, if not all, strokes improve. Time heals the brain. We get some more reconnections within the brain, and we improve. Physical, occupational, and speech therapy helps significantly with regaining function. So we implement those programs right away after a stroke. Within the first 24 hours, patients
Okay.
get their evaluation. And if they need, they may go to inpatient rehab. So we implement those plans right away. So therapy helps. From patient perspective, being motivated to overcome the symptoms of stroke and recover, that's a big plus. And having a good support system in place, that helps significantly too.
Okay. So before we go, what's the most important thing you want our viewers to know about stroke?
So two things. Keep in mind the risk factors and the preventable aspects of stroke, right? So a lot of these strokes are preventable.
Okay.
In case we end up with a stroke, recognize the symptoms fast and get help as soon as possible. So those are the two most important messages.
All right. Thank you, Dr. Alvi, for sharing all this great information with us.
Thank you, Mary.
Some really interesting things going on in the stroke world. Thank you. Well, that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about stroke, visit wvumedicine.org/stroke. And join us next week on Tuesday Talks when we'll talk about transcranial magnetic stimulation with Dr. Umar Najib, Director of the Transcranial Magnetic Stimulation Program at the WVU Rockefeller Neuroscience Institute. I'm Mary Ravazio Menard, and on behalf of Dr. Alvi and everyone at WVU Medicine, thanks for joining us and have a great day.